Hello,
Hi.
my name is Dean, and I'll be your student nurse today. And today we'll be performing a physical assessment. So from head down to toes. Any questions about that?
Mhm.
All right, before I begin, I ask if you've had a chance to void.
Yes.
All right, and sorry, if I could check your name and date of birth, please.
Samantha Penson, 03-13-99.
Thank you. Okay. So during this physical examination, I will be also assessing your mental state as well as your skin. Why is that a weird angle?
Yeah, I don't know. It's at a weird angle.
Was it like that for you?
Mm-hmm. Can I just go like that actually? I'm just gonna.
Yeah, it's good.
It's fine.
Okay. All right. To begin with, I'm going to start with your head. So I'll be palpating your scalp, looking at your hair distribution, palpating for any tenderness. Let me know if you feel anything.
Nope.
Okay. Moving on, I'll be palpating your TMJ. So open and close your mouth, please. I'm feeling for any clicks, which you do not have. Okay. Then I'll be palpating. No, sorry. Well, actually, I will. I'll palpate your frontal sinuses and your maxillary sinus. Now I'll be assessing your facial sensation. So I'm going to see your hand. So this is dull,
Mm-hmm.
sharp,
Mm-hmm.
soft.
Mhm.
Right? So close your eyes.
Dull. Sharp. Dull. Sharp. Soft. Sharp. Soft. One more time. Soft. Dull.
Okay. Now I'll be assessing your facial symmetry. So if you just close your eyes really tight and raise your eyebrows, puff out your cheeks. Okay. Thank you. All right. Moving on, I'll be assessing your neck now. So I am assessing your.
Sorry.
You're fine. Lymph nodes. So I'll be popping your lymph nodes. So your preauricular, your postauricular, your tonsillar, your submandibular, your submental, your occipital, your deep cervical, your superficial cervical, your deep cervical, which goes deep cervical chain, as well as your supraclavicular. Okay. Now I will be palpating your carotid artery. It's a strong, steady 2. Palpating your other side for the carotid artery. Okay. I am going to be listening with my bell of my stethoscope to your carotid artery as well, listening for any brevets. Oh, thank you, hold your breath, please. Thank you. Okay, I'll be assessing your trachea. Your trachea is lined up in the middle. I see no abnormal swelling. And do you feel any tenderness in it? Okay, I'll be palpating your trachea. Moving on to the, it's not your lymph nodes, it's your, wow. Palpating your, you know what, I'm gonna palpate regardless. If you could just swallow for me, please. Hopefully that name will come back to me. One more time. Thank you. I'll be assessing for jugular venous distension, which you have none. There's no veins distended, there's no abnormalities. Oh, this is gonna just drive me nuts now.
Okay, we'll come back to you.
You have your trachea, you have your. Okay, anyway. moving on, I'm gonna be assessing your eyes now. So, I'll be assessing your sclera, your eyelids, your pupils, and your lacrimal ducts. Your sclera are white, no abnormalities there, no broken blood vessels. Your pupils are dilated correctly. Your eyelids, I don't see any lesions. And for your lacrimal ducts, I don't see any abnormal discharge. Oh, these words. Okay, now, moving on, I will be assessing your, yes, your pupillary reflex, or your corneal reflex. It's a little slow, but that's probably because you wear contacts, eh?
Mm-hmm.
All right. I'll be assessing. That's more like, yes. Crosswinds corneal reflex, pupillary reflex. I see the light reflection on both sides. I'm gonna be assessing your peripheral, so cover the same eye as I am. Let me know if you see my fingers wiggling.
Mm-hmm. 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 Yes.
Opposite side.
Yes.
No,
Oh,
opposite.
sorry. Yes. 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 Yes.
Oh, my shoulder. Okay.
Yes.
I'll be assessing your extraocular movement. So 6 cardinal directions. So follow my pen. For this, Becca, if you could kind of also get like on this side as well too. Thank you. Just so you can see that her eyes aren't moving with it. Okay. Thank you. Now, I don't remember the name of it. I remember to do it. So, your pupillary light reflex. I don't feel like that's the right name, so I'm not even gonna like scratch that, X that out, but I know I'm supposed to do it. Assessing for the dilation and constriction of your eyes. Okay, now I'm gonna be assessing for accommodation, so look at the top. Now look past towards the wall, look at the top of my pen, look past towards the wall, and your eyes constrict and dilate accordingly with it. Now I will be using my ophthalmoscope to look for the red light, for the red reflex there. So I see the red light, I'm coming in, and I'm assessing your color of your retina, your blood vessels, your arteries, as well as your macular area. And it's like a light, what would that be, like a lightish yellow, I'd say. Same with the opposite side. Yeah, I guess a lightish yellow would be the correct. Okay. Moving on to your ears. I know I'm forgetting something, but that's okay. So I did your head, I did your neck, I did your eyes. Moving on to your ears. I'll be palpating your ears for any tenderness. Do you feel any?
Nope.
Okay. Now I will be performing the whisper test. So just
Sorry.
I'm gonna say something, I'm gonna whisper something behind you, so cover your left ear, please, and just let me know what you hear me say.
One more time.
Apples.
Apple.
Okay. And then,
Watermelon.
okay. Now I'll be performing the Weber test. So let me know if you hear this equally on both sides when I place it on your head.
Yes.
Okay. We're performing the Ryan test. So I'm gonna place it on your mastoid bone. Let me know when you can't hear it anymore, and I'll be placing it right by your ear, and let me know when you can't hear the air conduction anymore.
Can't hear it. Can't hear it.
Okay, so that was about even for both of them. Try the other side now.
Can't hear it.
Okay.
Can't hear it.
Okay, that side was a 2-to-1, so that is exactly what we're looking for. I'll be looking inside your ear now, looking at your tympanic membrane. Okay, and I see it. It's a pearly gray. Opposite side. It's pearly gray as well. Okay, thank you. Okay, so that's the ears. Okay, I'll be assessing your nose now. Yeah, I'll be assessing your nose. So, symmetry, okay. I'll be assessing your septum. It's not deviated, it's intact. I'll be looking internally at your nose as well too. Looking at the color, looking if there's any lesions or if there's any discharge. Okay. The color is a light pink. No abnormal discharges, no lesions. Light pink on the side as well. No abnormal discharge, no lesions. Thank you. I'll be checking the patency of your nostrils as well, so I can get you to cover one nostril and breathe, other nostril and breathe. Okay, thank you. Okay, now I'm going to be giving you a couple things to smell. So just close your eyes, plug one nostril. Tell me what you smell.
Peppermint.
Okay. Other nostril. Tell me what you smell.
Orange.
Okay. Okay, inside septum smell. Okay. Moving on to your mouth now. I'm going to be assessing your lips, your tonsils, your tongue, your gums, your teeth, and your mucosa. All right. I'm blinking. Sorry. All right. I will be checking out your soft palate and your uvula. Say ah for me. Okay. And we're testing your gate reflex. There we go. Sorry about that.
No, it's okay.
Alright. That. I'll be checking your tongue movement. Take your tongue out, up and down, side to side. Thank you.
Excuse me.
I think that's it. Your mouth. Did head, did neck, did eyes, ears, nose, mouth. Okay. I can't remember that name. Anyways, I don't have time to worry about that. Obviously, I will be now assessing your pulmonary. Yes, so I get you to lay down, please. Well, maybe I shouldn't have had you lay down. I apologize.
It's okay.
You can be up for this one. I'll lower you down slowly. But I am.
Yeah.
Yes, please. I will be lowering your gown a little bit here. I'm going to be assessing your pulmonary for symmetry and for any crepitus. Okay. I'll be palpating as well, feeling for any tenderness on the back as well. Okay. Now I'll be palpating for chest excursion. So breathe in, out. In, out. We're palpating for tactile formitis. So we just say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
As well as on the anterior.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. I will be percussing. And on the posterior. Now I'll be percussing your diaphragmatic excursion. So just take a couple breaths, get ready, and then take a deep breath in and hold it, and going from resonance to dual. Okay, you can let it all out. Do I should get what I do? Okay. Just take a couple normal breaths, take a deep breath, and then let it all out, and going from resonance to dual again. Sorry, one more time. Okay, I'm gonna raise your bra just a little bit. Okay. Now same for the other side. Take a couple breaths, and then take a deep breath in and hold it. Okay, let it all out. Now, take a couple breaths and take a deep breath in and let it all out. Okay. Measuring that. You are at 2 centimeters on that side, and this one is about 3 centimeters. So it's normal within your range. Now I'll be auscultating. So I'll be listening with my diaphragm to your lung sounds on the posterior side. So just take deep breaths in. And laterally as well. And on the exterior side. Okay, thank you. Now I'll be assessing your cardiovascular. So I am assessing for any visible contours, any PMI. Now I'll be palpating your apex, your left sternal border, your left base, and your right base. Now I'll be listening or auscultating to your, using my diaphragm, to your aorta, to your pulmonary, second pulmonary, tricuspid, and your mitral. Now I'll be using my bell to listen for any bruits at your aorta, pulmonary, second pulmonary, or second pulmonic, tricuspid, and mitral. Okay, thank you. Moving on to your abdomen now. We can get you to lay down. Put this down here. I'm going to lower you down a bit for you. Okay, take your arms up if you need to, make it easier. All right, so now I'm assessing your abdomen for color, for any scars, any visible contours. Okay, now I will be, I'll be auscultating with my diaphragm at your right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. Now I'll be using my bell to listen to your arteries at your abdominal aorta, your renal arteries, your iliac arteries, and then your femoral arteries. Okay. Now I will be percussing at your right upper, right lower, left upper, left lower. Now I'll be palpating. Actually, no, I'm going to move over and palpate your liver span. Tasting. So after this, I'm going to have you sit up and you're going to go through the tasting. All right. So I'll be percussing your liver span. So I'm going to come down from resonance is dual. Or the dual resonance. Dual resonance. Either way. All right, I'll be measuring that, and that is about 3 centimeters, so that is the normal range. Now I will be palpating lightly in your right upper quadrant. Let me know if you feel any tenderness. Your left upper quadrant, your left lower quadrant, and your right lower quadrant. I'll be palpating deeply now in your right upper, your right lower, your left upper, and your left lower. Any tenderness, anything? No? All right, I'm gonna have you lean a little bit. I'll be palpating for your liver span. So take a deep breath in. Okay, I can feel it. It's smooth, there's no nodes on it. Thank you. I'll be palpating your abdominal aorta. Okay, now I'm gonna get you to sit up and turn away from me. I'm gonna be palpating your coast over roll at angle. So I'm gonna give you some slight pressure on there. Let me know if you feel any tenderness.
Nope. Nope.
Okay. Now, before we move on, I realize I forgot something in the mouth part. I'm gonna be assessing your taste sensations on your tongue, on your anterior and posterior part of your tongue. So just let me know if you taste sweet, salty, sour, or bitter. Start with the anterior.
Salty.
Okay. Oh. Yes, I was about to do that again. Okay.
Sweet. Bitter. Sour.
Okay, moving on to the posterior part of your tongue. Stick it out a little bit if you can.
Sweet.
Sorry.
Wow, no, it's okay.
Sorry.
It's really salty. That's it.
Oh, I thought I made you gag there. My
No,
bad.
no, it's just really salty. Sour. Bitter.
Okay. I still can't remember the name. All right, anyway, moving on to your musculoskeletal now. So, I'll be assessing your hands, assessing the warmth, your cap refill. I'll be palpating your
Oops, sorry.
your proximal and your distal carpal and metaphalangeal, metacarpals and yes. For any tenderness, let me know if you feel the metacarpals and phalangeal joints.
Mm-hmm.
Okay, nothing?
Nope.
All right, now I'll be assessing your little lumbar here, assessing your grip strength. Okay, grip strength is even on both sides. Now I'll be assessing your range of motion and strength in your neck. So I just need you to flex, extend it. I think it's adduct and no, sorry. Laterally. And then chin to shoulder, chin to shoulder. Thank you. We'll be doing your shoulders now. So flex. Oh, it feels so good. Oh. And then outward rotation and inward rotation. Doing your elbows, flex and extend. I feel like there was one more, but I can't think of it. Oh my gosh. We're just gonna, you know, we're just gonna go through so many range of motions that I can't. All right. Moving on to the wrist. So flex. Okay. Ulnar deviation and radial deviation. We got flexing and extension. Pronation and supination, moving to the fingers. Pull radial and ulnar deviation as well. Fingers. Thumb in. Okay. Moving on, I'll be assessing your peripheral sensation. So, just like the face before, let me know if you feel sharp, dull, or soft. Oh, if I can get on this knee.
Sharp. Dull. Soft. Sharp. Sharp. dull, soft.
Okay. Now, I'll be assessing your peripheral pulses, starting with your radial. I got a strong, consistent 2. Radial. There we go. A strong, consistent 2 as well. Okay.
Just trying to remember this.
Moving on to the lower extremities.
I'm like shaking a bunch. I'm gonna try to like study this.
Actually, thank you. I'm moving on to sten. It's a word I can't pronounce for some odd reason.
This is not helpful. Okay.
Stenography, or yes. Okay, I'm gonna place an object in your hands. You have to let me know what it is. Close your eyes, please.
Nail or screws. Nickel, dime.
Other hand.
Screw, nail, and a button.
All right, thank you. Now we perform the graphesthesia. So, I'm going to draw a letter or a number in your hand, 1 through 10. So,
6. Z. Z.
yes.
Z.
I didn't remember that one. Now, I'll be performing a 2-point test on you. Just let me know. So I'll be touching your arm with these Q-tips. Let me know when you no longer feel 2 points. Close your eyes again.
2, 2, 2, 2, 1.
Okay. Is that about 2 centimeters? Now, moving on to lower extremities. I'm gonna have you lay down, please.
Are you sure you want me to lay down?
I mean, when I remember something, I'll come back to it, but yes. And I'm going to be assessing your symmetry of your body. Thank you. Now, I'm going to be assessing your range of motion for your hips. So if you could just bring your knees up, flex. Oh. Thank you. And then adduction, abduction out, and then rotate them in and out. Thank you. Now I'll have you sit up again. Oh, and back to the upper extremities. I'm going to have you quickly pronate and supinate your hands, testing your fine motor coordination. Touch each fingers. Heel to shin, touch your nose, and come to my finger. Touch your nose, come to my finger. Quicker. Sorry. Thank you. Back to lower extremities.
Whatever you say, officer.
Back to lower extremities. I'll be assessing your range of motion and strength for your knees now, so just flex them.
Want me to stand up first?
What would be easiest?
Standing up.
Okay. Okay, other leg, which I can't do. Ankles. Inside out. Okay. Now I'll be assessing your scoliosis test. So I get you to turn around and then over, please. And your spine is not off to one side. It's right. It's essentially in the middle. There's no deviation of it, thank you. I'll be assessing your gait. You can probably just stay on this side, Becca. She's gonna walk, holy shit, oops. She's gonna walk towards me. So just normal gait, walk towards me. Thank you, turn around, walk back. Now heel in front of toe, heel in front of toe, walk towards me. Thank you, turn around and walk back. Hop on one foot, outer foot. All right, you're performing the Romberg test. Close your eyes and stand still. All right, there's no unnecessary waving and wavering. Thank you. Holy cow, oh my gosh. You hopped. Thank you, you're done, You can sit back down now. Now, I will be assessing your peripheral pulses again, starting with your femoral. I'm gonna come up here. That's a strong 2. Popliteal. This strong 2 as well. Oh, I can't bend down. Your dorsal pedalis, which might not be. Got a 1 on that on my right side. I can't feel it on my left, which is not unusual. Now for your posterior tibial. Which I have a strong 2 as well. Moving on to, sorry,
No, it's okay.
gotta be back up. I'll be assessing your reflexes. No, I won't be assessing your reflexes. What is it? Oh, I'll be assessing, so same as the hands, I'll be assessing your feet for your color and temperature, which they are cold, but it's a little chilly in this room, so I mean, but you don't feel any discomfort from them, okay? As well as your capillary refill, which is about at a 2, which is normal. Okay, moving on now to the reflexes. I'll be assessing your brachial reflex. So make your arm, just relax your arm and my arm. Okay. Okay. Your brachial radialis. Okay. Okay. Your tricep. Okay. Okay. Your patellar.
Good.
Okay. Your Achilles. Sorry,
No,
I
that's
dropped your
okay.
foot. And your Babinski sign, which may not be. Your toes don't curl on that one. They don't curl on that one, and that's not unusual. Okay. And since I cannot think of what I am forgetting, that concludes this assessment. So any questions? Thank you.